Welcome to today's videocast on procreation and ethical dilemmas. Our focus will be the complex intersection of reproductive rights, legal precedents, and ethical challenges that healthcare professionals and organizations face every day. We'll begin by revisiting the historic 1973 Supreme Court decision in Roe v. Wade, which fundamentally shaped the national conversation on abortion. From there, we'll explore how subsequent court cases and legislative actions have addressed critical topics such as counseling, consent, partial birth abortion, and funding. Next, we'll turn our attention to the Dobbs v. Jackson decision, examining its profound impact on abortion rights and considering how it may reshape the future of reproductive health care. Beyond abortion, we'll also delve into the legal implications of sterilization, artificial insemination, and surrogacy. Each of these reproductive options brings unique ethical concerns and regulatory considerations for healthcare providers and administrators. Finally, we'll discuss the intricate issues of wrongful birth, wrongful life, and wrongful conception, concepts that highlight the delicate balance between medical responsibility, patient autonomy, and legal liability. Join us as we unpack these critical issues, offering insights that will guide ethical and effective healthcare management in a rapidly evolving landscape. Abortion refers to the premature termination of pregnancy and can be broadly categorized as spontaneous or induced. Spontaneous abortions, often referred to as miscarriages, occur without intentional medical or surgical intervention. Induced abortions, on the other hand, are deliberately carried out through medical or surgical means. These may be elective, undertaken by choice, or could occur incidentally, such as when a necessary medical procedure results in the end of a pregnancy. Legal implications for healthcare managers, regulatory compliance. Healthcare managers must ensure that their organizations comply with all relevant federal, state, and local regulations governing abortion procedures. This includes adhering to specific gestational limits, counseling requirements, consent laws, and mandatory reporting protocols. Institutional policies. Developing and enforcing clear internal policies is critical. These policies should outline permissible procedures, define staff responsibilities, and address conscientious objections from healthcare providers. Risk management. Healthcare managers must balance patient rights with the institution's legal obligations. Proper documentation and informed consent are crucial to mitigating legal risks associated with both elective and incidental terminations. Staff education and training. Ensuring that clinical and administrative staff understand current laws, ethical guidelines, and organizational policies helps maintain consistent, legally compliant care and reduces the potential for litigation. Patient privacy and confidentiality. In accordance with HIPAA and other privacy laws, managers must safeguard patient information, especially in cases where abortion remains controversial or restricted in certain jurisdictions. By proactively addressing these considerations, healthcare managers can help maintain ethical, safe, and legally compliant practices surrounding abortion and premature termination of pregnancy. In its landmark 1973 decision, Roe v. Wade, the U.S. Supreme Court affirmed a woman's constitutional right to choose an abortion, but also recognized the state's evolving interest in regulating abortion procedures across pregnancy trimesters. First trimester. During the first trimester, Roe placed the abortion decision primarily in the hands of the woman and her physician. For healthcare managers, this means ensuring that clinical environments support patient autonomy and confidentiality, with policies that facilitate unbiased counseling and informed consent. Second trimester. In the second trimester, the state may impose regulations reasonably related to the mother's health. Healthcare managers must keep abreast of any applicable state laws, such as facility requirements, licensing standards, and procedural protocols, to ensure that the organization's practices remain legally compliant. This may include investing in specialized training for clinical staff and updating equipment to meet regulatory standards. Third trimester. By the third trimester, states may prohibit abortions except when necessary to preserve the mother's life or health. Healthcare managers should have clear protocols for handling such high-risk cases, ensuring rapid legal and ethical consultation when needed. These protocols must balance compliance with state law against a provider's duty to protect maternal well-being. Managerial considerations. In addition to staying current with changing legal requirements, healthcare managers must develop policies that address conscientious objections from staff while maintaining uninterrupted patient care. Effective risk management, thorough documentation, and ongoing staff education are key to minimizing legal exposure and delivering patient-centered services in accordance with Roe v. Wade and its subsequent interpretations. Decided the same day as Roe v. Wade, Doe v. Bolton significantly expanded access to abortion by striking down a series of restrictive requirements. The Supreme Court deemed unconstitutional the provisions that mandated residency in the state where the abortion was sought, that the procedure be performed only in a hospital approved by the Joint Commission, that a hospital's medical staff committee approve the abortion, and that various external consultations be obtained prior to the procedure. These measures were viewed as overly burdensome and intrusive, effectively limiting a woman's right to choose by creating unnecessary barriers to care. Managerial implications for healthcare organizations. For healthcare managers, Doe v. Bolton underscores the importance of structuring policies and procedures that align with current legal standards while also minimizing barriers to patient care. Specifically, policy development, institutions must review and potentially revise policies to ensure they do not impose undue burdens on patients seeking abortion services, such as requiring excessive committee approvals or consultations. Operational efficiency. Streamlined processes that eliminate unnecessary steps can improve patient satisfaction and reduce legal risks. Resource allocation. Managers should ensure that staffing, equipment, and facility infrastructure meet medical and legal requirements without overstepping constitutional protections. Staff training. Ongoing education helps clinical and administrative teams stay informed about legal updates, ensuring that they provide care in compliance with the law. Risk management, clear documentation, informed consent procedures, and respect for patient privacy are essential to reducing liability and maintaining patient trust. By proactively adapting to the principles established in Doe v. Bolton, healthcare organizations can better support reproductive rights and uphold patient-centered care. Abortion funding and healthcare management. In Beal v. Doe, 1977, the Supreme Court held that it is not inconsistent with the Medicaid portion of the Social Security Act for a state to refuse to fund medically unnecessary abortions. In Maher v. Roe, the court went further, ruling 6-3 that states may refuse to spend public funds for non-therapeutic elective abortions. These decisions effectively establish that government bodies are under no constitutional obligation to subsidize elective abortions, although they generally cannot ban abortion outright. For healthcare managers, this means that organizations relying on public funding may be restricted in providing or covering elective abortion services. The distinction between therapeutic, medically necessary, and non-therapeutic or selective abortions is critical. Funding may be available for procedures deemed essential to protect the patient's health, but not necessarily for those performed by choice. Current law, although Dobbs versus Jackson 2022 overruled Roe v. Wade, the core principle that states are not required to fund elective abortions remains intact. The federal Hyde Amendment also continues to restrict the use of federal funds for abortions, except in cases of rape, incest, or endangerment to the mother's life. As a result, healthcare managers must navigate varying state regulations and federal funding rules. They should establish clear guidelines for classifying abortions as medically necessary or elective, maintain compliance with funding restrictions, and ensure accurate documentation to avoid legal and financial liabilities. Now let's analyze this interesting case. In CMAT Corp. Versus Arizona Healthcare Cost Containment System, the Arizona Supreme Court ruled that the state must not discriminate in funding medically necessary abortion procedures. The court found that the state's constitution does not permit the state and the Arizona Healthcare Cost Containment System to refuse to fund such procedures for pregnant women with illnesses, while at the same time providing funds for victims of rape or incest, or when the procedure is needed to save the mother's life. This decision affirms that medically necessary treatments should not be denied based on the cause of the pregnancy or the patient's circumstances. For healthcare managers, this case clarifies the boundaries of state-funded healthcare and emphasizes the obligation to treat similar medical conditions in an equitable manner. Organizations that receive public funding must ensure that their policies reflect non-discriminatory practices. Managers should also train staff to understand and implement funding guidelines consistently so patients with health conditions receive the necessary care they require. The ruling highlights the importance of documenting medical necessity to justify funding requests. By collaborating with clinical teams to develop clear criteria for determining when an abortion is medically necessary, healthcare managers can significantly reduce risks. In Colautti versus Franklin, the United States Supreme Court ruled that states may protect a fetus if a physician determines it is viable, meaning it can survive outside the womb. In a 6-3 decision, the court recognized that viability must be based on the physician's professional judgment rather than on a fixed number of weeks of gestation or a universal standard. This principle underscores the importance of individual medical assessment in determining whether a fetus can be considered viable. For healthcare managers, Colautti v. Franklin highlights the necessity of clear protocols that respect a physician's judgment, while also complying with relevant state regulations. Managers should ensure that practitioners are adequately trained and supported in making viability assessments, which often require advanced diagnostic tools and specialized expertise. By providing access to appropriate resources and maintaining a collaborative clinical environment, managers can help clinicians make well-informed decisions regarding fetal viability. Furthermore, the ruling illustrates how state interest in protecting a viable fetus can coexist with a physician's obligation to deliver appropriate patient care. Healthcare managers must therefore stay updated on changes in legal standards and state-specific regulations, so their organizations remain compliant while respecting clinical autonomy. Effective communication, ongoing education, and consistent documentation are vital to balancing patient rights, professional discretion, and legal obligations in light of Colautti versus Franklin. Now let's talk about consent, So different states have taken varying approaches to the issue of parental consent and notification for minors seeking an abortion. In Missouri and Massachusetts, courts ruled that parental consent statutes were unconstitutional because they placed undue burdens on minors and did not sufficiently account for situations where a minor might be capable of making an informed decision without parental involvement. By contrast, Utah upheld a statute that required notifying a parent if the minor is deemed immature, reflecting a state interest in promoting family involvement when a minor may not fully comprehend the implications of the procedure. An important distinction is that emancipated minors, those who are legally recognized as independent, do not require parental consent at all. This highlights the legal principle that a minor's maturity level and personal circumstances should be taken into account when determining whether parental involvement is necessary. For healthcare managers, these rulings underscore the importance of staying informed about the evolving legal standards. Policies and training should address the criteria for determining maturity, the process for documenting consent or notification, and any available judicial bypass procedures. Clear guidelines help protect the rights of minors, respect family involvement where appropriate, and ensure compliance with state-specific regulations, ultimately reducing the risk of legal challenges and fostering a supportive environment for all patients. Continuing with the topic of consent, legal precedents have evolved to clarify the extent of consent required for abortion, particularly in cases involving minors and spouses. In some jurisdictions, parental notification is not mandated, and a minor's decision to terminate a pregnancy may be considered sufficient if she demonstrates adequate maturity and understanding of the procedure. However, courts have at times sent abortion cases back to lower courts to reassess a minor's capacity or reevaluate the state's interest in regulating access to abortion. When it comes to spousal involvement, courts have consistently ruled that requiring a husband's consent imposes an undue burden on a woman's right to choose. The father of the fetus, therefore, cannot legally stop an abortion from taking place. Such rulings recognize the pregnant individual's autonomy and emphasize that decisions regarding reproductive health ultimately rest with the person carrying the pregnancy. For healthcare managers, these principles underscore the need for policies that respect the legal autonomy of both adult patients and minors who meet certain maturity criteria. Staff should be trained to assess a minor's capacity to consent, follow any applicable judicial bypass procedures, if required by law, and avoid imposing additional barriers that could be deemed unconstitutional. Likewise, healthcare organizations should not require spousal consent for abortion services. By staying informed of legal precedents and adapting protocols accordingly, managers can uphold patient rights, reduce liability risk, and maintain high standards of care. Be aware that some legal principles, particularly regarding parental notification, minors' capacity to consent, and spousal consent, come from decisions predating the Supreme Court's 2022 ruling in Dobbs versus Jackson Women's Health Organization. Prior to Dobbs, courts generally held that requiring spousal consent was unconstitutional and that minors who demonstrated sufficient maturity could make abortion decisions independently or could petition a court via a judicial bypass. These rulings were largely grounded in the constitutional right to privacy first articulated in Roe v. Wade and refined in subsequent cases. With Dobbs overturning Roe, there is no longer a federally recognized constitutional right to abortion. This means that each state now has broad discretion to regulate or restrict abortion, and past federal precedents protecting certain aspects of abortion access, such as spousal or parental consent rules, may no longer automatically apply in the same way. However, it is important to note two key points. Existing state constitutions and laws. Some states have their own constitutional or statutory protections that still prohibit spousal consent requirements or guarantee minors a pathway to obtain an abortion without parental involvement. Potential new legislation and litigation. States can pass new laws or revisit older ones. Whether spousal or parental consent mandates will withstand legal challenges depends on each state's constitution and any remaining federal or state-level protections for personal autonomy or equal protection. In other words, while the specific principles you mention in this slide reflect earlier Supreme Court rulings, the post-Dobbs landscape leaves these issues largely up to individual states, so the details can vary widely depending on where you are. State regulation of abortion. Dobbs versus Jackson, 2022. In Dobbs versus Jackson, the United States Supreme Court held that the Constitution does not explicitly guarantee a right to abortion. The court reasoned that such a right would only be protected by the 14th Amendment if it were deeply rooted in this nation's history and tradition. After examining historical legal practices, the justices concluded that abortion rights did not meet this criterion. Consequently, the court overturned both Roe and Casey, despite considering the doctrine of stare decisis, which typically discourages overturning long-standing precedent. Implications for health care management. This ruling effectively returned the power to regulate abortion to individual states, creating a patchwork of laws and regulations across the country. For healthcare managers, this shift demands heightened awareness of local and regional legal frameworks. Administrators must continuously monitor changes in state legislation, as rules may evolve rapidly and vary widely. Ensuring organizational policies and clinical practices comply with relevant statutes is now more critical than ever. Healthcare leaders should also prepare for potential operational challenges, such as the need to modify patient intake procedures, informed consent protocols, or referral processes. In states where abortion remains legal, demand for services may increase if neighboring regions enact more restrictive laws. Managers should also consider the ethical and professional obligations of staff, respecting conscientious objections while maintaining patient access to care. Through careful planning, clear communication, and ongoing education, healthcare organizations can navigate this changing landscape while upholding both legal requirements and patient-centered values. State regulation of abortion. Dobbs versus Jackson, 2022. In Dobbs versus Jackson, the United States Supreme Court held that the Constitution does not explicitly guarantee a right to abortion. The court reasoned that such a right would only be protected by the 14th Amendment if it were deeply rooted in this nation's history and tradition. After examining historical legal practices, the justices concluded that abortion rights did not meet this criterion. Consequently, the court overturned both Roe and Casey, despite considering the doctrine of stare decisis, which typically discourages overturning long-standing precedent. Implications for health care management. This ruling effectively returned the power to regulate abortion to individual states, creating a patchwork of laws and regulations across the country. For healthcare managers, this shift demands heightened awareness of local and regional legal frameworks. Administrators must continuously monitor changes in state legislation, as rules may evolve rapidly and vary widely. ensuring organizational policies and clinical practices comply with relevant statutes is now more critical than ever. Healthcare leaders should also prepare for potential operational challenges, such as the need to modify patient intake procedures, informed consent protocols, or referral processes. In states where abortion remains legal, demand for services may increase if neighboring regions enact more restrictive laws. Managers should also consider the ethical and professional obligations of staff, respecting conscientious objections while maintaining patient access to care. Through careful planning, clear communication, and ongoing education, healthcare organizations can navigate this changing landscape while upholding both legal requirements and patient-centered values. State-by-state legality of abortion. Dobbs versus Jackson. Although the Supreme Court overruled Roe versus Wade in Dobbs versus Jackson, abortion itself was not made illegal at the federal level. Instead, the ruling returned the power to regulate abortion to individual states. This means that each state is now responsible for determining whether and under what conditions abortion is permissible within its borders. In its decision, the court noted several key factors that states should consider when crafting their abortion laws. These include protecting maternal health and safety, eliminating procedures deemed gruesome or barbaric, preserving the integrity of the medical profession, mitigating fetal pain, and preventing discrimination based on race, sex, or disability. While these guidelines do not constitute strict requirements, they reflect the court's view on what constitutes legitimate state interests. For healthcare managers, this state-by-state approach underscores the importance of regularly monitoring legal developments in their region. Managers must ensure that their organization's policies, protocols, and documentation practices comply with changing statutes. They should also train clinical and administrative teams to navigate new regulations effectively, maintaining high standards of patient care. In states that have enacted more restrictive laws, managers may face operational challenges such as resource allocation, staff objections, or patient referral processes. Conversely, in states with fewer restrictions, providers may see an influx of patients traveling from areas with tighter regulations. By remaining adaptable and proactive, healthcare managers can help their organization deliver ethically sound and legally compliant services. Abortion and conflicting beliefs. When two or more ethical principles come into direct conflict, individuals face what are commonly referred to as ethical dilemmas. Abortion often exemplifies this type of dilemma because the morality of terminating a pregnancy can be understood less as a strictly legal or constitutional question, and more as an issue rooted in philosophy, ethics, and theology. Reasonable people may hold profoundly different views based on their own moral frameworks, religious convictions, or philosophical outlooks. In navigating such divergent perspectives, one guiding principle is the obligation to respect the liberty of all individuals involved. This includes honoring personal autonomy and ensuring that the diversity of moral viewpoints does not lead to the imposition of one particular moral code on everyone. The goal then is to seek a balance that allows each person to follow their conscience while also recognizing the broader community's ethical considerations. Implications for healthcare managers. Healthcare managers must create an environment that respects a range of beliefs while maintaining high-quality patient care. This involves developing clear policies that support both staff members' rights to conscientious objection where legally permitted and patients' rights to receive care. Managers should also ensure proper training for healthcare teams, emphasizing empathy, confidentiality, and professional integrity. Transparent communication channels and well-defined protocols can help mitigate conflicts and promote a culture of mutual respect, ultimately supporting ethical decision-making within the organization. Now, let's analyze the topic of sterilization. So, sterilization is the process by which an individual's ability to produce offspring is intentionally ended. There are several forms. Elective sterilization. Patients choose this option voluntarily, often for personal or family planning reasons. Negligent sterilization occurs when a sterilization procedure is performed improperly, potentially resulting in an unintended pregnancy and exposing healthcare providers to legal liability. Regulation of sterilization for convenience. Laws may restrict or guide procedures primarily sought for non-medical reasons. Healthcare organizations must remain aware of any applicable legal requirements. Therapeutic sterilization involves sterilization for valid medical reasons, such as when pregnancy would pose a serious risk to the patient's health or life. Involuntary or eugenic sterilization. Historically, certain groups were sterilized without informed consent based on discredited theories of genetic improvement. Modern legal and ethical standards generally prohibit such practices. Implications for healthcare managers. Managers must ensure that their organizations comply with all relevant regulations and uphold ethical standards. This includes developing clear policies on informed consent, ensuring thorough patient counseling, and maintaining accurate documentation. Proper staff training is essential, so healthcare professionals can recognize the differences between elective, therapeutic, and other types of sterilization. Managers should also be prepared to address legal risks associated with negligent sterilization, as patients may pursue legal remedies if the procedure fails. By fostering a transparent and patient-centered environment, healthcare managers can help safeguard both patient rights and organizational integrity. Now, let's analyze the topic of artificial insemination. So, artificial insemination is a procedure in which seminal fluid is introduced into a woman's reproductive tract by means other than sexual intercourse. This process occurs outside of the body's natural fertilization pathway and can be used to address various fertility challenges. Two primary forms of artificial insemination are homologous artificial insemination. Uses the semen of the woman's partner or spouse. This is often chosen when a couple faces certain medical issues, such as low sperm count or minor fertility complications, but still wishes to maintain a biological connection to both parents. Heterologous artificial insemination involves the use of donor sperm, which may be preferred if the male partner is infertile or if there is no male partner. Donor anonymity and screening protocols are typically crucial considerations. Consent and confidentiality, because artificial insemination involves sensitive personal and medical information. Explicit informed consent is essential. Both the woman undergoing the procedure and, if applicable, her partner must understand the process, associated risks, and any legal or ethical implications. Maintaining confidentiality is also critical, given the potential emotional, social, and legal ramifications of using donor sperm. Implications for healthcare managers. Managers must ensure that policies and procedures comply with all relevant laws regarding consent, donor screening, and privacy. Staff should be thoroughly trained to protect patient confidentiality and to handle the emotional complexities surrounding artificial insemination. Clear documentation and transparent communication protocols help foster trust and support ethical patient-centered care. Now, let's analyze the topic of surrogacy. So, Surrogacy is a reproductive arrangement in which a woman, often called a surrogate, carries a pregnancy with the intention of relinquishing the child to another individual or couple after birth. Depending on the specific arrangement, the surrogate may be the child's genetic mother, sometimes referred to as traditional surrogacy, if she provides her own egg, or she may act solely as a gestational carrier when an embryo created from another person's egg and sperm is implanted in her uterus. Surrogacy agreements can help individuals or couples who cannot conceive or carry a pregnancy to term achieve parenthood, but the practice also raises legal, ethical, and emotional considerations. Implications for healthcare managers. Healthcare managers play a pivotal role in ensuring that surrogacy arrangements are carried out ethically, safely, and in compliance with relevant regulations. They must develop clear protocols for screening potential surrogates, verifying consent, and managing sensitive medical and personal information. Documentation must be thorough and consistent to reduce legal risk, particularly when navigating cross-state or international surrogacy agreements with varying legal requirements. Managers should also coordinate counseling resources for all parties involved, recognizing that surrogacy can be an emotionally complex process. By providing transparent policies, safeguarding patient confidentiality, and fostering a supportive clinical environment, healthcare managers can help ensure a responsible and patient-centered approach to surrogacy services. Now, let's analyze the topic of wrongful birth, life, and conception. So, wrongful birth, a claim brought by parents alleging that negligent medical advice or testing prevented them from making an informed decision about whether to continue a pregnancy. In other words, the parents argued that had they known about a significant fetal abnormality or genetic condition, they might have chosen to avoid or terminate the pregnancy. Wrongful life. A claim typically initiated on behalf of a child who is born with severe disabilities, arguing that the child would have been better off not being born at all. Courts often grapple with the ethical complexities of determining damages and whether a life, even with disabilities, can be deemed worse than non-existence. Wrongful conception. A claim arising when a failed sterilization or birth control procedure leads to an unintended pregnancy and subsequent birth. Parents may seek damages to cover medical expenses, child-rearing costs, or emotional distress, depending on jurisdiction and specific circumstances. Prevention of lawsuits. For healthcare managers, preventing wrongful birth, life, and conception claims involves establishing clear protocols for genetic testing, prenatal counseling, and informed consent. Ensuring that staff communicate effectively with patients about potential risks and available options can help avoid misunderstandings. Proper documentation of all discussions, test results, and patient decisions is crucial. By maintaining high clinical standards and transparent patient interactions, healthcare organizations can mitigate legal risks while providing responsible, patient-centered care. Thank you for joining today's videocast on procreation and ethical dilemmas in healthcare. As I conclude, I would like to review the main topics I covered. I began by discussing the broad landscape of procreation and the ethical challenges it presents in modern healthcare. I explained the complexities of abortion and premature termination of pregnancy, focusing on legal frameworks, trimester-based regulations, and state involvement in funding decisions. I then examined the conflicting beliefs that surround abortion, highlighting how different moral, philosophical, and theological perspectives can create ethical dilemmas. In doing so, I emphasized the importance of respecting diverse viewpoints while ensuring patient autonomy. I continue by exploring sterilization, discussing elective, negligent, therapeutic, and involuntary or eugenic sterilization. I stress that clear informed consent and rigorous procedures are essential to maintain high standards of care and prevent legal issues. I also delved into artificial insemination, explaining both homologous and heterologous methods and underlined the necessity of obtaining proper consent and safeguarding confidentiality. Next, I discussed surrogacy as a method of reproduction, differentiating between cases where the surrogate is the genetic mother and those where she serves solely as a gestational carrier. Finally, I addressed wrongful birth, wrongful life, and wrongful conception, emphasizing the need for thorough counseling and accurate documentation to mitigate potential legal risks. I appreciate your thoughtful engagement throughout this videocast. I encourage you to review these topics further and reflect on how these complex issues impact healthcare management. Thank you once again for your participation and commitment to advancing ethical and informed patient care.